My dad, Jack Hausman, is 99. He will celebrate his 100th birthday at the end of September. He's phenomenal. He is an extremely active senior, and he's led quite an interesting life. He's a World War II veteran. He was drafted when he was 21, and he fought with the combat engineers in North Africa, and then they invaded Sicily. My father was 98 when we first realized that there was a problem. It was just one day, you know, Linda, I really think that I need to see an eye doctor because I'm not seeing as well as I should, and my glasses need to be adjusted. And that's the way it started.
Well, Jack was referred to me by a general ophthalmologist for evaluation of his decreased vision in his right eye for suspected wet macular degeneration. Jack had quite an aggressive lesion from his wet macular degeneration. And I recommended Eylea because I thought in his particular situation that was the best drug for him.
Dr. Ferrone was wonderful. He walked us through all the pictures that he took, showed us exactly where the problem was, and said to my father that with the right medication, I can save your vision, and hopefully I can bring some of it back.
Unfortunately, when we went to the pre-authorization specialist in our practice to check with the insurance company to allow Eylea, we were told that Eylea was not allowed because the insurance company required step therapy or fail-first therapy before we could change to whatever drug we thought was best.
A 98-year-old man was forced to have 3 shots in his eyes that weren't doing anything before they would even consider using the medication that the doctor wanted to use in the first place.
He did not do as well with Avastin. It didn't dry up the wet macular degeneration as well as I wanted it to. And then after the required step therapy, again, a delay of 3 months, we're able to use Eylea, and the Eylea had a much better effect. His vision improved to a 20/30, 20/40 level from count fingers at 2 feet, and that came about from the use of the drug that I recommended.
I think step therapy is ludicrous. You're asking an insurance company who has no knowledge of the individual or the medical background to determine what medication a doctor has to give.
Well, I think we should end step therapy, and the reason is because we want to do what's best for patients. We should not be told what is best for patients by insurance companies that haven't examined the patient, are not there looking at the patient and evaluating their particular situation. They should let us do our jobs. We go through all this training to treat patients, to save them from blindness, and we know what the best option is for that patient.